Ever wondered about tuberculosis? What it is and how it affects the body? Tuberculosis, often referred to as TB, is a global phenomenon affecting millions across the globe. It's caused by a crafty bacterium known as Mycobacterium tuberculosis. This little invader primarily targets the lungs, transmitted from person to person through the simple act of breathing. It's a potent disease, one that has shaped human history and continues to influence our present. Intrigued? Stay tuned as we delve deeper into the workings of this potent disease. Now that we know what tuberculosis is, how exactly does it wreak havoc in our bodies? Well, the story begins when the bacteria, Mycobacterium tuberculosis, enters the body, typically through the air we breathe. This sneaky little pathogen prefers the high oxygen environment of our lungs, making this organ its primary target. Once in the lungs, the bacteria find themselves in a battleground. Our body's immune system is quick to respond, sending in white blood cells to fight off the invaders. These cells, particularly the macrophages, engulf the bacteria in an attempt to destroy them. But here's where things get interesting. The bacteria have evolved to survive within these macrophages, essentially turning their would-be executioners into their safe havens. Over time, a fascinating yet destructive process unfolds. The immune cells around the infected macrophages form a hard shell, creating what's known as a granuloma. Inside this granuloma, the bacteria are shielded from further attacks by the immune system, allowing them to lie dormant. This is the stage of primary tuberculosis, often showing no signs or symptoms. However, if the immune system weakens, the bacteria can break free from their granuloma prison and multiply, leading to secondary or active tuberculosis. This is when symptoms like persistent cough, fever, and weight loss start to manifest. It's important to note that not everyone infected with the bacteria progresses from primary to secondary tuberculosis. Many people can carry the bacteria in a dormant state without ever developing the disease. But for those who do, the consequences can be severe. In some cases, the bacteria can spread outside the lungs, affecting other organs like the kidneys, spine, and brain. This is known as extrapulmonary tuberculosis, which can be even more challenging to diagnose and treat. So that's how tuberculosis operates. But how can we tell if someone is infected? Tuberculosis can often be silent, but there are telltale signs and symptoms. One of the most commonly recognized symptoms of tuberculosis is a persistent cough that lasts for 3 weeks or more. This cough might also come with chest pain or pain with breathing or coughing. Unexplained weight loss is another key symptom. If you're dropping pounds without trying, it could be a sign that something's not quite right. Tuberculosis can also cause you to sweat excessively at night. These aren't your typical night sweats. They're often drenching and can interrupt your sleep. Fever and fatigue can also signal the presence of this disease. You might find yourself feeling unusually tired or running a low-grade fever for no apparent reason. These symptoms may seem common, but when they persist, it's essential to seek medical advice. Early detection is vital in managing tuberculosis effectively. Recognizing these symptoms could be crucial in getting timely treatment. Speaking of which, how is tuberculosis treated? The good news is, tuberculosis can be treated and managed effectively. The cornerstone of tuberculosis treatment is a regimen of 4 antibiotics, typically including isoniazid, rifampin, ethambutol, and pyrazinamide. This combination is taken for the initial 2 months, followed by isoniazid and rifampin for the remaining 4 months. It's essential to understand that the success of this treatment hinges on adherence. This means taking the medication exactly as prescribed for the entire duration of the treatment. Cutting corners or stopping early can lead to drug resistance, making the disease more difficult to treat in the future. In addition to medication, management of tuberculosis may include isolation to prevent the spread of the disease, particularly in the early stages of treatment when it's most contagious. Nutrition also plays a key role in supporting the body's recovery. With proper treatment, tuberculosis can be completely cured, but there are some misconceptions about this disease that need to be addressed. Let's clear the air on some common myths about tuberculosis. Many believe that tuberculosis is a hereditary disease or it only affects the poor. But here's the truth. Tuberculosis does not discriminate. It can affect anyone, regardless of age, gender, or socioeconomic status. It's not passed down through genes, but through the air, from one infected person to another. So let's bust these misconceptions and arm ourselves with the right information. Remember, Knowledge is power. Stay informed, stay healthy.